Senator Bernie Sanders, welcome to the Tom Joyner Morning Show. You're now talking to some 8 million, mostly African-American listeners. Welcome to the show, sir.
Tom, great to be with you.
All right. And on the line with us is Don Lemon, Roland Martin, Jacque Reid, and Reverend Al Sharpton.
Good morning, everybody.
Good morning.
We'll start with Don Lemon.
Good morning, Senator. How you doing?
I'm great.
You're great. You have had a very busy couple of days. I should say a very busy couple of months.
Yes.
Can we talk about something that's really important for everyone? We have been discussing health care and also discussing the changes that you would expect to make and change Obamacare to some instance. So listen, you've heard of Kenneth Thorpe, right? Who is
yes, I think he's working overtime for the Clinton people. Yeah.
Okay. He is saying that your health care plan is illusory, that it would end up costing low-income and middle-class people more, that the cost of your health care plan would outweigh the benefits. How do you respond to that?
I think it's absolute nonsense. Look, we are taking on the establishment. We're taking on the moneyed interests. We're taking on the insurance industry. We're taking on the drug industry. Every major country on earth, Europe, Scandinavia, Canada, has a national health care programs which guarantee health care to all of their people. And without exception, the United States is spending far, far more per capita on health care than do the people of those countries because they don't have insurance companies and drug companies ripping them off. We have hundreds of health care experts and economists who are refuting Mr. Thorpe's point of view. The fact of the matter is, and let me repeat it, a Medicare for all single-payer program will guarantee health care to every man, woman, and child in this country. It will save the average middle-class family some $5,000 a year in their health care costs.
And he says that you're underestimating the cost of your plan by roughly $1.1 trillion a year, that it cannot
when you take on the establishment, I mean, the question that we have got to ask ourselves is, are we satisfied with 29 million people having no health insurance, with even more being underinsured with high deductibles and high co-payments, living in a country in which we pay the highest prices in the world for prescription drugs, such that 1 out of 5 Americans can't even afford to fill the prescriptions their doctors write? Every other country on earth, major country, has said, no, that's not the way to go. We need a national health care program. Now, obviously, the insurance companies and the drug companies don't like what I have to say on this issue. But as I've mentioned, there are hundreds of economists and healthcare experts who are refuting Mr. Thorpe and who are saying, yes, this is a much more cost-effective way to go. I helped write the Affordable Care Act. I'm on that committee. It has done some very good things, but we still have a long way to go to provide quality health care to all of our people. Every day, there are people out there who have $5,000, $10,000 deductible, and they can't afford to go to the doctors because they don't have the money in their own pockets.
Senator, I don't want to take up my time for my rest of my colleagues here, but according to PolitiFact says that you did not help write the Affordable Care Act, is that you were involved in it and helping get it passed, but it shows that you did not help write that, and that by you saying that and your spokespeople saying that, it's simply not true.
No, that is. I am on the committee. It's the Health, Education, and Labor Committee, formerly chaired by Ted Kennedy, then chaired by Chris Dodd for a while, and then Tom Harkin. I am on that committee that helped write that bill. That's irrefutable. I am still on that committee. And in fact, one of the major provisions in that bill was an expansion of federally qualified community health centers that I helped write with Jim Clyburn over in the House, which is now providing health insurance, health care to some 6 million people who otherwise would not have had it. That is indisputable.
From Washington, D.C., Roland Martin, good morning.
Senator Sanders, I want to talk education, critical issue facing African Americans. Two-parter. First off, what specifically is your plan to strengthen HBCUs in America? The second part is this here. What will you do about primary education? And are you a supporter of charter schools and vouchers? Black parents, we polled at TV One, nearly 80% are in support of charters and vouchers. Where do you stand, HBCUs as well as K through 12 public education?
All right, hold up, Roland, because we're going to do this in two parts, and Senator, you will answer that question, please, at the top of the hour. I have to go to commercial break. Okay?
Good.
Thank you, sir.